benefits management team that focuses obviously on keeping our members well. So we have various care management programs that are available to our individual and family members. Obviously, those care management programs, the earlier we can identify members with conditions, the sooner we can get them in these care management programs. We have such programs as pregnancy care for high-risk maternity members. We also have a house calls program, which if members qualify, they actually have a PCP, which will come to their house if they have qualifying conditions. So those are some of the health management programs that we're very proud of. So let's talk a little bit about, excuse me, our service area and our network. So we currently offer our plans in 4 counties in Northeast Ohio. So if you're looking at this map, the Akron area is right here in Summit County. Cleveland is this county right here directly to the north of Summit County. So to give you a perspective, excuse me. So we offer our plans in 4 counties. And basically that is because our network is really centered around Summa Health System, which is our parent company. So they have what's called an accountable care organization. Excuse me, frog in my throat. So we really piggyback on their provider network, which is very extensive in these 4 counties. So that is the main source of providers. But then knowing we also need a children's hospital in our network, we do offer coverage through Akron Children's Hospital here in town, which is a very well-known and respected children's hospital. We offer one option of Cleveland Clinic hospitals directly to this county to our south, which is Stark County. We offer access to Mercy Hospital, which is part of the Cleveland Clinic network. And then we also, it's not on this sheet here, but we also offer access to the Crystal Clinic, which is a very well-known local orthopedic clinic here in the Akron area. So I would ask you to keep in mind that it is a fairly limited network for this plan. It's called the SC Connect network, and you can see the counties and the main systems that are included in the provider network. So I think as you're selling the plan in these counties, you want to stress to your clients that they don't have access to all providers in these counties. It is a very broad network in the counties, but it is a Summa-based network, so it is somewhat limited. Now, for emergency and urgent care, inside of Ohio, we use a network called Ohio Health Choice. Now, of course, folks can get coverage for emergency and urgent care from any provider, but they get a little bit better coverage if they use Ohio Health Choice, if they're inside Ohio. And then if they're outside of Ohio, if they use the First Health Choice network, they get the strongest coverage. All of this information is included on the back of the member's ID card. So, as they're traveling and if something were to happen, all of this information is included on their card, or they can always call member services and get direction from there. So that was one of the main things I wanted to point out was the network and the service area for these products. So now a little bit about the actual plans themselves. So we offer most of our plans either on or off the marketplace. So there are 3 silver plans that are offered off the marketplace only. That makes sense to folks. Obviously, we know that for folks to get a subsidy for their individual and family plans, they have to enroll through the marketplace. I don't think that's a surprise to anyone. As far as quoting and enrollment for our plans, they can be done via Broker Central, which is our online broker platform, which I'll get into in a moment. They can enroll either on or off, or you can enroll on or off via that platform. Or if you use a third-party enrollment system, such as Health Sherpa, we are on the Health Sherpa platform, so you can enroll members via that platform. And then obviously, if you're just going on enrollment, you can use the marketplace itself, healthcare.gov. So there's several ways to enroll members in our plan. this is kind of background on the plans themselves, and I think everyone selling individual plans probably already knows this information, such as the metal tiers. For example, there's the catastrophic coverage, the bronze, silver, and gold. As far as platinum plans go, for 2025, there are no plans in Ohio that offer, no carriers in Ohio that currently offer the platinum plans. So, from a SummaCare standpoint, we are catastrophic, bronze, and silver and gold are the plans that we offer. Catastrophic, I think folks probably know that these are available for individuals that are under age 30 in most circumstances. Those catastrophic and bronze plans have the highest out-of-pocket expenses, but they also have the lowest premiums. The silver plans are kind of your middle range, out-of-pocket, premium-wise, expense-wise. And then gold and platinum have those lowest out-of-pocket expenses, but the highest premiums. And as I mentioned previously, really in Ohio, there are no carriers offering the platinum. So this obviously is background that I'm gonna flip over. This is obviously a training deck that I had used right prior to the OEP, the open enrollment period opening. So I think we know this year the open enrollment period will be November 1 of 2025 through December 15th of 25. I don't believe they're opening it up through January, which they've done for the past couple of years, but there'll be more information to come on that information. So let's talk a little bit about our plans themselves. So we all know that the services that are actually covered are identical on the plans, except on our plans, the adult vision exam and vision hardware may or may not be included in all plans. All of our plans are HMO plans.